The M component of geriatrics is the mind, and the mind is something that the geriatrician will look at very closely when meeting an older person for the first time. Any patient, but in particular, or older patients, we're looking for mental health, cognitive challenges. So a geriatrician may choose to do a sort of a memory screen, for example, the mini COG, the mini mental status exam, or the MOCA, the Montreal Cognitive Assessment. This will look at different facets of the cognitive status, the cognitive evaluation, for example, attention span, visual spatial, executive function, verbal fluency, naming tests, and short-term memory, word recall. So there are various screens for memory and parts of cognition that a geriatrician and a primary care, frankly, can do in order to help identify what parts of the patient's daily function may be affected. And in this way, use that as a method for guiding what are the next steps. If there is an aspect to a person's mind, their cognition, that does have deficits or challenges, it is important for the geriatrician or the primary care provider to seek a person or some aid, some form of assistance to help this person out, whether it be the healthcare proxy, a family or friend, somebody who can support them with these roles. For example, paying the bills, doing grocery lists, organizing medications and pill boxes of these various things. So the M for mind is very important. The M can also stand for the mental health, the mood portion. So screening for depression, for example, is also very important. PHQ-2 or 9 are some easy screening tools that one can use to identify, which is really important for who in the community may be affected by depression or a mood disorder or anxiety, something to a good time to talk about what supports are at hand. Are there counselors that can come into the home? Is there a mental health clinic? Are there support groups that are available? And also to get to the bottom of why exactly is this person experiencing this depression or anxiety or this mood disorder. Alzheimer's dementia is the most common form of dementia, and it is one that often is characterized by memory loss, and is something that families notice or begin to notice, but it's a more gradual course. So it is often difficult for families to really see the onset. However, after a while, they'll start to notice that with the memory impairment, there are also other deficits, forgetting how to do certain functions, and it's becoming it's causing a lot of disruption to their daily life. It is a complex diagnosis that requires a lot of careful and thorough evaluation. There's a lot of negative stigmatism about the diagnosis of Alzheimer's dementia, and so for this reason, it's very important for geriatricians to counsel family members and patients on what the prognosis is, what to expect, and what the natural course might be. It's important to also stress the emphasis of maintaining good cognitive stimulation, social supports, and going out and seeking new activities and participating in things, not to become more isolated just because one feels that they can't remember things or they feel embarrassed. It's important for families to really support the patient through this very difficult time and to seek the resources together in a way that the patient may feel supported and not outcast. If a primary care provider feels that a patient requires more evaluation from a neuropsychiatric standpoint or neurology, it would be a fine time to send to a specialist for evaluation, neurologist, neuropsychiatrist, having more thorough screening, evaluation to really get to the bottom of why perhaps this person is experiencing memory loss or disorganization or other stressors that frankly are very really concerning to the patient and their families. For a patient who is diagnosed with depression or anxiety or a mood disorder, it is very important for that patient to seek appropriate mental health services and care. This may include medication management with a psychiatrist and should also importantly include the addition of a psychotherapy counseling with an appropriate therapist. This pairing of the medication plus the counseling, I believe to be very important in supporting a patient's overall recovery and maintenance of a good mental health picture. If the patient is blessed to have surrounding community supports, it would also be a good structure to have family and friends who are aware of the person's mental health struggles and provide lasting and consistent support throughout this difficult period. This is something that a patient should know is common in the older population and also in the country at large. It's something that healthcare providers are working to solve with greater supports in the mental health realm. There are some programs that will send mental health providers into the patient's home to work with them if it is easier for those patients who are unable to get out in the community. There are more community support groups. There are more forums online, and there are even, for example, where I work, there are embedded geriatric psychiatry clinics within the clinic itself so that patients are able to go there and not experience confusion or more stress in trying to find the appropriate clinic.